In Alabama, this is the front page of the Montgomery Advertiser today. You see here, it says, quote, ER has patient traffic jam. ER as in emergency room. Frustrated, overwhelmed, exhausted, Alabama emergency medical technicians say a dangerous COVID wave filling the state's ICU beds has triggered a cascade of issues in the state. Patients at the East Alabama Medical Center in Opelika and Auburn are being held on ambulance stretchers while staff look for open beds, resulting in huge problems. Quote, ambulances lined the ER bay in what hospital spokesperson John Atkinson called a patient traffic jam that keeps out-of-town ambulances sidelined and unable to respond to other emergencies in their own communities. Alabama reported a net negative number of available staffed ICU beds yesterday. Negative, which means they have no room and there are patients waiting to get into the beds that are already filled. There are more patients than beds right now. And here's the thing that I find most unsettling about this. And this involves some very, very, very easy math. The situation that Alabama's in right now is happening with the state having about 2,700 patients in the hospital. That is the level of hospitalization in Alabama that has led to this big crisis. 2,700. Today, the University of Alabama at Birmingham predicted that the state's current surge in COVID is going to peak this time next month. And at that point, there will be more than 5,000 people in the hospital in Alabama. That's almost double where they are now. Right now, the state is in gridlock, in crisis. No room for, not an ICU bed in the state. That's with 2,700 people in the hospital. Alabama expects it will be at 5,000 people in the hospital this time next month. This is not a normal story about COVID exhausting local nurses. A doctor at the University of Alabama is calling that scenario, that prediction, quote, potentially apocalyptic. Alabama, like a number of other states, is overwhelmed right now. The Alabama Department of Public Health, like Louisiana, is now asking FEMA for federal help. They're requesting federal staff, federal resources to help treat the unending overflow of patients that gets worse every day. But at this point, yes, one hopes to see more federal resources deployed. But at this point, I have a hard time understanding how facilities, how hospitals, how states like this are going to cope. Joining us now is Dr. David Kimberlin. He's the co-director of the Division of Pediatric Infectious Diseases at the University of Alabama, Birmingham. Dr. Kimberlin, I really appreciate you being here tonight. I know what an intense time this is.
Well, I appreciate the chance to be with you tonight, Rachel. Thank you.
So I'm just looking at this from the outside, and I'm a layman here, and I am appreciative of the strain on healthcare workers and hospital facilities right now. That math scares me in terms of how strained Alabama hospitals are right now and the prospect that numbers of hospitalized patients, people who need to be hospitalized, might nearly double within a month's time. Let me just ask if that looks any different to you close up than it seems to me from here.
You know, from the inside, it looks even worse. I use this word carefully. I think we may be looking at a collapse of our healthcare system throughout the state of Alabama. As you pointed out, we had a net negative ICU beds yesterday. That's for adult and pediatric ICU beds. Today, Alabama surpassed Florida in terms of rates of pediatric hospitalizations with COVID. And this is not just, the surge with the Delta variant of COVID. That's what's putting the obvious strain on the system. But in addition to that, everyone else, we still have people having heart attacks. We still have people having strokes. We still have people with major trauma from automobile accidents, and they have to have a place to go. And in Mobile today, what I was told by a colleague down there, they had no ambulances. There were no ambulances to go out and pick up people. We are really at a teetering kind of break point here, and I'm very scared that we might not be able to get through this without catastrophic kind of consequences.
And I don't mean to push you on that, because I think you're speaking very bluntly, but it sounds like if there's no ambulances right now in Mobile and there's no ICU beds to move people into them when they need intensive care, and there aren't hospital beds to move people into from the emergency room who already need them, that already feels like it's starting to be a collapse. But you're expecting that as more patients crush the system, as more very sick people crush the system, there's something on the other side of this that is even more bleak in terms of what people's lived experience is.
I mean, none of us have a crystal ball, and I'd love to be wrong on this, but that is the real possibility that we're, the barrel of the gun we're looking down right now. I think you're exactly right in the way you phrase that.
Tell me about resources being brought to bear to help. We have seen HHS dispatch a team to operate a field hospital in the parking garage at the University of Mississippi Medical Center. We saw a small Navy team dispatched to a hospital in Lafayette. They're going to be able to staff 16, 18, 20 beds maybe. Tell us about the match between the magnitude of the problem that you're living through and what kind of external resources might make a dent, might help.
Well, I think right now we do need help from outside, no doubt about that. And we have a phenomenal leader of our Alabama Department of Public Health, Scott Harris, who was in meetings all day today with the White House representative, a vaccine coordinator leader from the White House who's here in Alabama. And this was one of the lead issues that they were discussing throughout the day today. He's going to be here tomorrow as well. We welcome the input from the White House and from the national level to be able to try to get us the resources that we need. And in addition to that, I will say this in a somewhat hopeful kind of a way. We have seen this play out, maybe not to this extent in our part of the country, but we've seen it play out over and over again across the last 18 months in other regions of the United States and to some extent here as well back in January. And so we have an idea of what to do. We know how to take care of patients better who have COVID. We have adequate PPE supplies for the most part. We aren't struggling with some of the same really dire challenges that we were facing last year. We just now have too many patients, and this hyper-transmissible Delta variant it's not giving us any breaks here. And until people put masks on when they go inside and get more vaccines into arms with sleeves rolled up, I think we are going to just be looking at this event over and over again. Even after we do get through this crisis, we will get through it, but it's just what it's going to look like in the meantime.
Dr. David Kimberlin, co-director of the Division of Pediatric Infectious Diseases at the University of Alabama, Birmingham, which is obviously an excellent university and the flagship research institution, healthcare research institution in the state. Thank you for speaking so bluntly tonight, sir, and good luck to you and your colleagues as you go through this. Please come back to us and keep us apprised. We'll keep covering the story, and we'd love to bring whatever national attention we can to try to help.
We really appreciate that. Thank you.